People do better at home. I think they really want to be at home for medical treatment. They're more comfortable. They just want to be in their own environment, have the food that they want, have access to family and friends the way they normally do, and be in that routine.
Can you talk a little bit about the different groups of people who might be a good candidate for the home health care?
Home health care is an excellent choice for those patients who are in an acute phase of one of their conditions. They've had a chronic disease and they need management at home. Any wound care that they may need. Patients who are post-op, coming off of total joint replacements. We have a total joint replacement program where those patients go into the hospital or surgery center, have their joint replaced, total knee or hip or shoulder, and then they come home and we do an evaluation and start rehab services right away so they can avoid being in a rehab center. We have a lot of ways to offer resources for patients. We have our visiting physicians who come in when patients can no longer go out to the physician.
I think I was reading somewhere on the Visiting Nurses Association website that you can do x-rays at home, or did I read that right?
Sure. We've seen x-rays at home, we've seen EKGs at home, anything a physician can prescribe that you used to see only in acute facilities, a lot of that is done at home.
When you think about home health care, people often wonder about the cost. How expensive is this as opposed to a skilled nursing home?
Well, cost is always something huge, and it's much less expensive to treat a patient in the home. Medicare services pay 100% at home for straight Medicare, and the majority of our population are elderly under Medicare services. And other insurance companies do cover most of it, and occasionally you'll see a copay with that.
Have you seen certain things that just make you feel like, oh, yeah, this is really going in the right direction? I'm really happy to be a part of this.
Yeah, definitely. I've been a nurse with the VNA Health Group for 27 years now, and I started out in the field. I was out in the field for many years. And there's nothing like seeing a patient in their home environment, looking at what the obstacles are, being able to connect with them on that one-on-one level. You become part of their family, and we see it all the time. And I am so fortunate to be able to see the compliments and the things that people say coming into our office on a regular basis now, and being able to share that with the organization. It's pretty amazing, that connection that you'll never get in an acute care facility. We walk into a home and we're right away doing a full assessment. We can see the obstacles, throw rugs that are in the way that could cause a fall, tubing from oxygen in the kitchen that could potentially cause a fire. Boxes of medications that are old, and some medications that are brand names versus generic, and people are taking duplicates. So we can see if a patient is going to be safe in the bathroom. Do they need grab bars? Do they need a shower chair? Are they taking care of their personal hygiene? So you're not going to see this in a hospital where someone is taking care of a patient regularly. That home environment gives you a totally different outlook.
If I have, a loved one who's just had surgery and I've got some options here, I'm not sure what to do, can you give me a little idea of how to get started there?
People don't know that this exists until they really need it. And I get calls almost every day with that same question. So it's very easy. Patients and families can call us directly. They can speak with their physicians. If they're in a facility, they may be offered home care services, but it's very easy. Just connect with us. We can reach out to get that referral from the doctor.